Social Service Workforce webinars funded by PEPFAR and implemented under the auspices of the Social Service Workforce Strengthening Alliance by USAID partner CapacityPlus. So this session today will review some of the highlights from a recent landmark conference on child protection systems strengthening in sub-Saharan Africa that was held in Dakar, Senegal this past May. We'll also share lessons learned from the process of mapping child protection systems in Western and Eastern and Southern Africa. And these are processes which inform many of the topics that we discussed at that conference and which have also provided some valuable information about the social service workforce and its role within these systems. So today's session will begin with opening remarks from Brigette DeLay. Brigitte's a technical advisor for child justice and child protection systems strengthening for the UNICEF West and Central Africa Regional Office. Brigitte's a professional social worker with a Master's of Social Work, no less, who began her career as a Peace Corps volunteer in Mauritania in 1987. She's continued her work in child protection with various nonprofit organizations in Africa, Asia, Latin America, and in the United States. More importantly, Brigette served as one of the organizers and the intellectual authors of the Dakar Conference. Today's session will also feature presentations by Guy Thompstone from Child Frontiers and Manolo Cabran from Maestral International. Guy is one of the directors and founders of Child Frontiers, which is a company that's based in Southeast Asia and specializing in child protection. Like Brigette, Guy's a professional social worker by training and is now based in Malaysia. Since establishing Child Frontiers in 2008, he's conducted a number of mapping and assessments for child protection systems in Southeast Asia, in West Africa, and in the Middle East. Manolo Cabran is a child protection specialist with Maestral International. His expertise is in the areas of child protection, strategy development, social protection, community development, and in the education sector. He's currently consulting for UNICEF Malawi, where he's carrying out mapping and assessment of the Malawian child protection system. And he's assisting the Malawian government and its partners to develop a strategic plan to enforce child protection legislation. He's joining us from Malawi today. He's worked previously in several other countries, including Italy, Senegal, Bhutan, primarily on child protection systems, mapping, and assessment. So each presentation will be followed by an opportunity to engage in a short question and answer period with our speakers, moderated by Jim McCaffery from CapacityPlus, who's very well known to us by now. We're also fortunate to be joined today by Patrick Onyango, Country Director for the Transcultural Psychosocial Organization in Uganda, and Stephen Adongo, Director of the Department of Social Welfare in the Ministry of Employment and Social Welfare in Ghana. Both Patrick and Stephen will introduce our discussion time by offering a few ideas for creating partnerships between community and government level stakeholders. Just a little bit about Patrick and Stephen. For the past 2 years, Patrick's been supporting the Ugandan Ministry for Children as well as selected public universities to develop and integrate child protection curricula into undergraduate and postgraduate degree programs as part of a process of strengthening the social welfare workforce. He's also, in recent years, been deeply involved in system strengthening work in Uganda, in particular trying to figure out how to strengthen linkages between formal and informal community level actors. Stephen Adongo he leads a team of social workers, administrators, and other professionals for the Ministry of Employment and Social Welfare in Ghana. He previously served in the Department of Social Welfare as a general caseworker and as a district social welfare officer, a head of human rights promotion and protection, and a head of the Justice Administration Division in several regions of Ghana. And just a note about this discussion time, we always try to save a little bit of time at the end of our session to hear more about your experiences. And today we're hoping to learn a little more about your experiences with mapping and assessments and what you've learned about the workforce. So before I hand the floor to Brigette, I just wanted to see if Chris Horvath, our Illuminate technical expert, do you want to walk us through a few important features of the Illuminate technology for those of us who are unfamiliar with a few, with a few of the new updates, or do you think we've covered it, Chris?
Yes, I think we did cover it. The one quick thing I just want to mention for our moderators, or I'm sorry, our presenters, is that you can advance the slides using the little arrow keys that appear up into the above the right corner of the whiteboard. So you see left and right facing arrow keys there, and that allows you to page through the presentation.
Yeah.
Yeah, so just briefly, I just want to note that there are left and right-hand arrow keys up above the right-hand corner of the whiteboard for our presenters that allow you to page forward or back in the presentation. So as our speakers, as you want to advance through the slides, you can just click on those buttons. I think I've covered everything else.
Great, thanks so much, Chris. And it's always good to know that you'll be with us for this entire 2 hours, just in case. So as I noted earlier, this is the 6th webinar in our series. As a reminder, we launched our webinar series last July, so that was almost a year ago, with a session on lessons learned from the global health workforce. That was followed by a second webinar in September on social service workforce training curriculum, a third in November, which reviewed accomplishments in the field of social service workforce strengthening since our social welfare workforce conference in Cape Town in 2010, and a webinar in January, which focused on community-based social service workers and was conducted in both French and English. And then finally, our most recent session in April, which focused on case management, caseloads, what casework tools and resources are appropriate for the social service workforce in strengthening systems of care and providing for better coordination of services for vulnerable children. If you missed any of these, do not worry. All sessions were very well attended, and summaries, PowerPoints, and a recording from each of these sessions can be found on ovcsupport.net, where we will also post all of the information about this session and about future sessions. So for those of you who are unfamiliar with ovcsupport.net, please note that this website includes a range of resources and information on how to engage in social service workforce strengthening initiatives, as well as more general information on programming for vulnerable children. Unfortunately, and I see we have quite a few colleagues from Côte d'Ivoire here today, but unfortunately most of these resources are almost exclusively in English. And this webinar will also be held in English. However, we're eager to increase the number of documents posted in other languages, so please send them to us if you have additional resources that you would like to share in English or in any language. Please send them to ovcsupport.net@msh.org. So at this point, please join me in welcoming Brigette DeLay for a few opening remarks. Brigette.
Thank you, Maury, and good afternoon, everyone from Geneva. I just want to make sure that everyone can hear me. Okay, I'm assuming that I'm coming across loud and clear. I have the pleasure of sharing with you all today a brief overview of the conference on child protection systems strengthening in sub-Saharan Africa that Maury briefly mentioned earlier, that was held in May this year in Dakar, Senegal. And the conference was organized by over 9 agencies across 2 regions, both West and Central Africa and East and Southern Africa, and involved over 300 participants. And it included over 36 country delegations that were made up of government, UN, international NGOs, civil society, and others. And these country delegations, I would say, represented what we like to call the pioneers in the new movement, the new global and regional system strengthening movement in child protection. So the goal of the conference was to basically reinforce, support, and sustain national efforts. There was a focus on the national efforts to improve child protection systems, impact on children. And this was done through cross-country exchange, dialogue, and learning. And there were 5 interrelated objectives that are worth revisiting. The first was to take stock of current efforts and experiences to build stronger child protection systems in sub-Saharan Africa. Where are we? The second focused on sharing promising practices in strategy development and programming around system strengthening, monitoring and evaluation and resourcing those systems, and to provide participants with the most up-to-date resources on systems building as well. Our third objective was to review, discuss, and improve current system strengthening frameworks and guidance. Fourth was to provide opportunities for networking with the aim of building stronger regional and country-level partnerships committed to strengthening systems. And the last was basically to explore the establishment of a regional mechanism that could continue to support national efforts and foster ongoing learning and exchange on system strengthening in sub-Saharan Africa. In short, there is recognition that we're in a very intense learning phase around system strengthening. And the conference was designed to sort of break down some of the current learning barriers. Most of the learning to date has been either at a country level or through global dialogue. And this was the first opportunity for countries who have been experimenting and investing in system strengthening to come together and share their experiences. So the conference covered a broad range of topics about different system components, and one afternoon was dedicated to workforce strengthening strategies. And some of those specific sessions included how to conduct a human resource gap analysis with a focus on low-resource countries, the importance of social work associations, building workforce capacities in allied systems such as justice and other areas, and more. And for more details on these and related sessions, you can find them on the conference wiki. We experimented with some social media and setting up a wiki site which has provided a record of the discussions and the sessions. So everyone should, these are public pages, everyone who has interest in learning about the social welfare strengthening sessions as well as broader system strengthening work can explore the website and the wiki to learn more. In addition, the conference presented several methodologies for mapping the child protection system, and these range from what we call broader snapshot mapping methodologies, including the 2 that will be presented today, to more specialized assessments of mapping individual system components. For example, mapping workforce through the human resource gap analysis that many of you are familiar with, or doing a policy review, or mapping community protection mechanisms. And I'd like to just highlight one quick note about the difference between the term child protection system and social service systems. We use the term social service rather than child protection when talking about the workforce to acknowledge the larger system in which child protection is situated, a system which concerns itself with the welfare and protection of a broad range of vulnerable populations, not just children. What we will hear about today in terms of mapping, basically the mapping strategies outlined by our presenters today take a broad view of child protection, and they map the workforce as one component within the broader context of a national child protection system. They look at specific structures, functions, and components to address both issues of maltreatment as well as prevention, such as social protection programming and access to basic services. And these strategies also include very unique methods for furthering our understanding of the role of the workforce within the understanding in the context of a broader systems framework. So what is distinct here is that mapping the workforce is done as one part of a broader mapping of the system and not done in isolation. So the results of the mapping exercises described today have provided a foundation for a range of exciting efforts to strengthen systems to support for vulnerable children and families, and have led to, among other things, some great results, including increased funding for social services in some countries or an expanded workforce. And although broad in scope, They're useful in identifying gaps and opportunities for workforce strengthening within the context of a broader system and can trigger more specialized, detailed workforce assessments needed to make better decisions, such as the human resource gap analysis. And it is our hope that the teams who attended the conference can continue these efforts, and we look forward to hearing more about their many achievements today and in the future. And with that, I will pass it back to Maury. Thank you very much.
Thank you, Brigette. And for those of, I fortunately was able to attend in Dakar and feel very, very fortunate to have had that opportunity. For those of us that weren't able to attend, is there a place where we can go and find out more information about what happened there, a website or something that we can post?
So the wiki is your best source, and we were very lucky to establish a wiki which not only has provided all the PowerPoints both in English, French, and Portuguese, but there are also discussion notes that we're taking in all the concurrent sessions. So it is an excellent resource to find out what happened at the conference. And in addition, there were 3 live webinars that were produced during the conference, and those are uploaded on the community Protection Exchange Forum as well. So there's actually, this conference was very well documented, so anyone who is not there should be able to access all the resources very easily.
Excellent. Thank you again, Brigette, and we look forward to hearing more from you later in the webinar. Just before we move on to our first presentation, just a reminder to all of you that you are welcome to write any questions or comments or thoughts or ideas in the chat window at any point during these presentations. And we will make note of those questions, and at the conclusion of these presentations, we'll pose your questions to the presenters and give them an opportunity to ask those questions. And during that question and answer period, once we go through some of those questions that you've posed in the chat window, we'll also see if we have an opportunity to invite you to talk as well and to ask those questions yourself. And I also wanted to remind you, if you haven't done this already or you just wanted to practice using the chat window, please let us know who you are. We know that some of you are participating as a group right now, and some of you are logging in as individuals. So please let us know who you are and where you're from so that we can have a sense for who our community is. And on that note, I am going to pass the floor to Guy Thompstone, who's going to begin with our first presentation.
Good evening, everybody. I hope you can hear me well enough. I'm currently based in Kuala Lumpur, Malaysia, so probably the furthest east of any of the participants this evening. What I'm going to be speaking about only for the next 10 minutes are a number of very broad macro findings from mapping and assessment that we at Child Frontiers have had the opportunity to participate in, along with partners from UNICEF, from Save the Children, from Plan International, since 2009 until the current time. And the findings that I will be presenting in the next few minutes come from 4 mappings in Southeast Asia, Indonesia, Laos, Malaysia, and Timor-Leste. From West Africa, these are the studies that you're perhaps most familiar with, that were conducted in 2010 and 11 in Benin, Cote d'Ivoire, Ghana, Niger, Senegal, Sierra Leone, and most recently in Lebanon in the Middle East. As I said, these are just going to be some very macro broad findings that I know Manolo will elaborate in a case example from Malawi later on. So just to start with, a very brief overview of the child protection system mapping and analysis that have been conducted in those mentioned countries. The main aim is perhaps to begin to understand the relationship between the formal and informal systems, understanding the historical and socio-economic context of the development of the formal systems, to understand the influences that have shaped the current formal systems. As well, I think one of the most important sort of evolutions of the mapping has been to really try to explore the functioning of the formal systems at the local level, and to understand the perception of families and children about that formal system, and whether or not the formal system is helpful, relevant, appropriate to their needs, to begin to explore and articulate some of the alternative processes that they use, communities and families use, when children are at risk, particularly of abuse, neglect, exploitation and violence, but also in the West Africa context, we looked also at children in conflict with the law. The research methodology, I will just go through very quickly, is based upon both qualitative and quantitative methodologies using both primary and secondary data sources. In the specifics, a literature review is conducted at the country level using approximately 200 documents, depending on the availability. Semi-structured interviews, perhaps up to 20 in any country, and at all levels, i.e. at the central level with policymakers, key experts, and across a number of different ministries, welfare, justice, education, health, as well as at the local level, or rather the provincial or district levels, with decision makers and those responsible for children's welfare at that locality. We also used a social welfare sector survey, which I will speak about in a minute, as well as disaggregation matrices for human resources. Next, we would conduct a national service mapping, and I will show you a slide in a minute, that in order to demonstrate the distribution and typologies of services across the country. Finally, and perhaps of greatest relevance, for focus group discussions with service providers, both professional social workers, parasocial workers, volunteers, direct service providers essentially, working with communities, families and children in welfare and protection, as well as trying to ascertain the opinions, perspectives of community and religious leaders, as well as potential service beneficiaries, i.e. children and families. So the idea was to get a rounded set of tools in order to be able to triangulate different opinions, perspectives on the functioning of the system. And in particular relevance to the social service workforce, one of the aims was to be able to understand the roles and functions of different social service providers at the local level, looking at the type of system within which they were working and to see what functions and roles they had been assigned. And through this, as Brigette mentioned, it helps us to understand within the broader framework of a national child protection system whether it is viable given the existing and future human resources, i.e. whether those human resources that exist or those that are planned for the future would be able to sustain the implementation of a formal system as it is on paper. Just to recap, the actual methodology is only one of many within the assessment of the National Child Protection System. It is one component So in order to understand more about the social service workforce, we conducted, with partners on the ground and local research teams, an indexing of current government social welfare workforce, trying to see the total numbers of government staff, the distribution of the workforce across the country, as well as the ratio to population and to poverty indicators, essentially to be able to see where the workforce is located and what kind of numbers of people of the population that they were responsible for. Secondly, to look at the review of their functions, mandates and powers within that system, as well as through an illustrative survey of both government and non-governmental social service workforce to understand more about their working practices, their length of service, their qualifications and training, and their sense of job satisfaction. Now then, I'm going to just highlight in this very short time 3 key findings. 2 that are perhaps challenges, and 1 that I feel is very much an opportunity in moving forward. The first finding is perhaps that, as many of you will be well aware, there are often very limited resources for the social service workforce. That often the model or typology of formal system that is envisaged in policy and through strategic documents is not necessarily realistic to the financial resources to fund a social service workforce, to implement the kind of responsibilities that are on paper. In particular, we're looking at West Africa, the countries that we were involved in studying there, is that none of the countries allocates more than 1% of the national budget to child protection. And as a consequence of this, salaries tend to be fairly uncompetitive, are sometimes or often paid by foreign donors, and a fact that we noticed particularly in Southeast Asia, which we can't substantiate scientifically, but is certainly well known as hearsay, is that the retention of professional social workers in particular is very, very low, which means that whilst there may be a strong cadre of qualified professional social workers within the workforce, that many of them don't take up social work positions. Another factor is perhaps the lack of costed human resources strategy. We do know, for example, that in many of the countries of West Africa, as well as Southeast Asia, and I think of Thailand, Indonesia, Malaysia, as well as in West Africa, formerly in Sierra Leone, but in Côte d'Ivoire, have had strong traditions of social work, but that often these social work schools have been disrupted through conflict over the past years, which means that those social work schools perhaps do not produce the cadre of social workers that was envisaged. I'm just going to leave you with some figures here before moving on. When you look at some of these numbers of government social service workforce, you see that, for example, in Ghana, there were 700 government social welfare officers identified, which meant one social worker for every 40,000. And when we go down to Niger, you see that it was 1 social worker to 168,000 people. But that's not children, that's population, which for any social worker is obviously unmanageable. The following slides will just demonstrate a little bit the sense of inequitable distribution between urban and rural centres, and suggest that there is often a multitude of responsibilities that are taken on by government social service providers. In many of these countries, and we see this also in Southeast Asia, many social workers or social welfare officers are responsible for children, elderly, veterans, people with learning disabilities, mental health, an absolute multitude of different people. Now then, this slide, I hope you'll have a chance to look at later on. It's really just a demonstration of the range of government professionals compared to NGO professionals, compared to volunteers. As you will see, in some countries of West Africa, Ghana, Niger, Senegal are highly dependent upon volunteers within their social welfare, social service workforce. In Niger and Sierra Leone, for example, you see very, very low levels of government social workers compared to the levels of population. This is just a simplistic diagram from Côte d'Ivoire that shows the distribution of social workers in one particular area, Direction Régionale Lagune, which you will see obviously has the largest quota of social workers in the country. And I will provide reports if necessary to substantiate some of these findings. Just to indicate, these are the kinds of maps that we are able to draw out from the findings that show and demonstrate the kinds and numbers of social service providers across the territory. You'll have more time perhaps to look at this slide on your own later on. Just secondly, the second key finding in the very limited time available now is really the issue of congruence. Now then, probably many of you will have heard of talking of congruence in recent debates. I think what we found in both regions, as well perhaps as in the Middle East, is that the role of the social welfare workforce, the government social service workforce, is often highly formalized in a sense that they have specific mandates, powers, duties, responsibilities under a national law or under policy, often requires a fairly high level of statutory response, essentially to children and families that are already in crisis, which means that these are resource-heavy systems that they are to implement and to apply. However, what we did find, again, it's very difficult to explain in a short time, but was that many of these roles that were designated or allocated to social workers were actually incongruent with the needs, values and expectations of communities. And in particular, in terms of expectations, we see that communities do not necessarily expect government social workers to be involved in their family affairs. And that, in fact, many of the social service workforce revert back to community processes. Indeed, what we were seeing coming out very, very strongly from the findings was that often social workers and communities are more familiar and comfortable with traditional approaches to child protection and see a value in customary law, family mediation and local resolution mechanisms. And that many of the endogenous community practices are actually seen to provide a cheaper, quicker and fairer outcome for children rather than reverting to more statutory-based government social workers or social welfare officers. And this leaves many of the social welfare officers caught between two parallel systems. Just finally, I know my time is up, I think we also need to recognize as a great opportunity the essential role of the many, many experienced direct service providers that work with families and communities at the local level, who are perhaps not mandated, who are perhaps not employed by the government, but who have less administrative, more proactive community development roles, working directly with families, and that their proximity and their understanding of community cultures is especially relevant. And this is perhaps in Southeast Asia, we find that in non-heterogeneous societies where there is great diversity of population, that having a social worker that is more connected to your needs and your culture is absolutely essential. Finally, just a slide that this is actually from Sierra Leone that represents the working experience of the people that we interviewed. Social welfare providers, both government and non-government. You will see here just the length of service that many people have already offered or contributed, which can be seen as a great positive to be taken forward. So with that, I think I'm over my time, but thank you very much for your attention.
Okay, thank you, Guy. Now we're going to spend about 10 minutes doing a couple of things. One is, as everybody was listening to you, they may have had either comments that they want to add to one of the points you were making or several of the points you were making, and you should feel free to add that into the chat window. And then secondly, if there are questions, you should feel free to write those in the chat window, and we'll try to get to as many questions as we can during this period. I see there are some there already, and I also wanted to take us back to ask a question that I think is central to the kind of work that we're doing. You had, Guy, a slide on your research methodology with respect to human resources. And in that, you talk about indexing current government social welfare workforce, as well as reviewing the functions, mandates, and powers. And I was curious, because there are a lot of people that are now interested in this kind of data, how easy it is to retrieve this data, how accurate you think it is, and how up-to-date it is.
Okay, thank you for that. It is not easy to retrieve this data. However, I would say it's easier perhaps than retrieving financial data. Yes, in a number of countries, for example in Sierra Leone, there are no records or formal records of the number of government social welfare staff. We know from findings that, and this was a few years ago, I have to say, that there were a number of people on the books, as it were, who were no longer actually working and employed. In other countries, in Malaysia, where I am now, there are very formal mechanisms for capturing the number of people on the government payroll. However, of course, when it comes to capturing numbers of NGO workers, other social service providers, that is much more complex, not least because we're trying to decipher what actually is a child protection or a social welfare, a child welfare role. In some countries, the mandates and powers of a social worker are found in job descriptions, in policy documents. Their powers and duties, of course, may well be found within the law. In other countries, I'm thinking of Timor-Leste, which has had a more recent history of a social welfare workforce and sector. There are certainly much less formalized job descriptions and information to glean.
Thank you, Guy. That was very helpful. And there have been a number of questions in the chat box relating to costing. So let me just kind of capture some of the elements of those questions, and perhaps you could address them. One was simply on the question of how did you collect information on the cost of financing the system? There was a question from somebody Patrick, who was in Dakar, and said we learned from the national budget technocrats that they actually lack costed CP data that they can use to allocate funds in the national budget frameworks. And then there was a question from Rwanda, which said, did you face any challenges in defining social services as a percentage of national budget, as some countries must have, some countries must have different definitions of what services to include within the allocation. So I'm giving you those three questions. They're all around costing and some of the issues with it.
Hi. Sorry, I had real difficulty hearing you then in terms of individual questions. I think I got the general drift about collecting questions around sort of finances. Yes, this is particularly difficult. Many of the, as Brigette was explaining earlier, when we look at human resourcing and costing of human resources, it is only one part of a much bigger framework. So we do not go into a huge amount of depth. What we try to look at is the overall allocations to social welfare sector, which may come from a number of resources, to look at that as a percentage of GDP, to look at increases, percentage increases over the years. In some countries, you're almost able to make a projection based around the current and envisaged budget allocations for social welfare. In terms of looking at very specific information around budgets and salaries within a social welfare department, this for us certainly became much more difficult, in that often exact allocations of or percentages of funding to institutions or to salaries or to vehicles or to welfare services are often not very accurate. And in some countries that we've worked in, and I won't name them, this information actually is not available. It's not actually sort of written and available.
There was one other question that you probably didn't hear, as it may have tailed off. It came in from Rwanda, and that is, was there a difficulty, or is there a difficulty in trying to collect costing data when different governments may have different interpretations of what social work or social services are?
I'm sorry, I lost you about halfway through there. Costing data.
No, sorry, Guy. Let me see. Can you hear me now, Guy? Hello, Guy.
Yeah, please go ahead.
Okay. The question was about how social service. What do you think I find it exactly? Do you have it? That wasn't it. Yes, it was around. The real issue was countries must have different definitions of what services to include, which within this allocation. And so it's essentially challenges in defining it and how that affects your costing data.
Yes, that's very true. I mean, we do, through our matrices, try to look at very specific government services to see whether they are included within the broader framework or definitions of the role of a social welfare department, for example. But yes, it is notoriously difficult to actually get full definitions of these social services. For example, what we are seeing in many countries is that, and you will know this, a huge sort of allocation towards institutions. Now then, when you see, for example, where I was in Lebanon recently, I think it's nearly 70% of the social welfare budget goes to institutions. However, when you try to define what the purpose of those institutions is, you really have to try to be able to delineate the nature of that service. For some, it is the institutions are for children that are in detention, essentially. Others are for children coming from poor families. Others are educational services, part funded by the education sector. Others really are sort of much more drop-in services for children in need of special protection. So yes, defining those boundaries of social services is particularly difficult. And essentially what we have done recently is really just to collect as much data to take the broadest allocation possible, and then to be able to try to distinguish what we would determine as child welfare, child and family welfare, child protection, to sort of try to see where the allocations lie.
Okay, thank you, Guy. We just have one last question, then we'll move on. But there was a question, not a not costing question, and this was a question about that came in that said, I would be interested to know whether there was input from children themselves and whether their opinions about reverting to traditional systems were the same as those of adults in the community. So maybe a few words about that.
Okay, that's actually a very good question. The first part of it, yes, and I think this the importance of speaking with children during a mapping and assessment process really became clearer as we progressed. In some of the Southeast Asian studies that we did originally, we had much less formal input from children. However, in West Africa, what we found was that by conducting focus groups with adolescents, separate groups of boys and girls, as well as with younger children under 11 or 12, we found that we got very, very rich sources of information. Particularly, children, young people were able to articulate what their needs and sort of expectations were. Now then, what was particularly interesting was the way that they were able to articulate the basic need for food, for shelter, for a safe passage to school every morning. In terms of their protection needs, to be able to elaborate or articulate how certain factors in their daily lives contributed to their safety and protection, or else diminished or reduced their levels or their perceptions of their welfare and protection. So those discussions with children were absolutely essential, and I would really recommend that in any mapping. Were they different from adults? I can't give you a precise scientific answer to hand, but certainly what we did find was that there were a number, this is very general, macro, that there were a number of commonalities in terms of both families and children identifying their needs or priority needs as a good family, as basic shelter and nutrition, good education, So, in a sense, children and adults often had similar perspectives, but maybe for different reasons. And children obviously were able to articulate their specific needs perhaps more coherently than the adults, who also tended perhaps to make some assumptions about the needs and desires of children.
Okay, thanks, Guy. That was both a really good question and a really informative response. And there are other questions coming in. There's a couple particularly good substantive questions that just came in from Cote d'Ivoire. We won't handle that right now. We want to move on to the next presentation, but we will have time for more general questions at the end as we move ahead.